Get started on the panel. Kevin Nelson and the committee asked if I would spend a few minutes talking also about care and the work that we're doing in food policy here in New Haven before we turn to the panel. So I'm going to talk pretty quickly and just give you a little bit of background. Our CARE, the Community Alliance for Research and Engagement, has this kind of ambitious goal of improving health here in New Haven through leadership, community engagement, collaborative community research, and dissemination of findings. And a better way to say it, a shorter way to say that, is that our goal is to bring evidence to action for better health. We work with many, many, many current partners in the community and at the university, particularly in the city and the schools, a number of nonprofits, and in the faith and business communities. Our Cornerstone Research Project was born here at Yale, and a soon-to-be alum, Kathleen O'Connor, was actually part of this, Community Interventions for Health, which has now taken as its home Oxford Health Alliance. But community is right at the center, along with a focus on neighborhood schools, work sites, and health centers. And that's become the cornerstone of what we're doing. So as Dr. Dietz described, we in fact can take a coordinated chronic disease approach. We were talking just for a moment at the break, Dr. Mullen, was your question, and also issues around reorganization, but thinking about the underlying behavioral risk factors like diet, exercise, and tobacco, and then of course the broader social and economic factors as well. This is an audience which I don't have to defend to you why chronic disease, but of course I'd be remiss if I didn't at least say prevention once. They are preventable, and of course, as we know, very, very costly. So in New Haven, our focus has been on 6 low-resource neighborhoods. All of you have lived here, most of you have lived here at one time or another, and these are the neighborhoods in which there is, of course, from premature birth to premature mortality, these are the neighborhoods that really require our attention. We changed the way we do research. I've been at Yale since 1989 for going on 24 years. I count among you many of my students, including I love to say that, including Dr. Mullen. But you're older. That's okay too. I don't mind you saying that. And in 20 years of doing NIH and CDC-funded research and research funded by foundations, never before have I really been able to transform the way we do the work. Instead of hiring a few people for a long period of time, 3, 4, 5-year grants, we made a decision to hire a lot of people and do the work in a short period of time. And that was to be responsive to community needs. And so when we began this work in 2009, we hired 32 local residents. Actually, we began in the summer by working with youth to do community mapping and environmental scan. Then, by Labor Day, we had hired 32 women and men from the community. By Columbus Day, we were out in the field. Done by Thanksgiving. Done what? We had done 1,205 neighborhood surveys from randomly selected households, as well as nearly 1,200 surveys and physical assessments in the schools, all in 7 weeks. By Christmas, or Hanukkah, or Kwanzaa, or whatever you celebrate, solstice, we had reported preliminary findings. And by the first quarter of the following year, we were out doing community dialogues. We're repeating that again this year, particularly with the 2 hospitals as part of the Accountable Care Act requirements for community health needs assessments at the hospital. Of course, we're also working with the health departments and with Data Haven and other community partners to do this work. But we were so pleased with this accelerated timeline that we're doing it all again, and I'm really looking forward to it. So just very, very briefly, we began our work with youth, Magalis Martinez and The Color of Words, along with Youth at Work from the mayor's office. They were the ones out there doing this mapping. And it will be no surprise to you to see that when we look at, I pulled this map of the food environment, that the orange dots reflect fast food restaurants and the purple triangles reflect the convenience stores. And so we think about these calorie-dense environments. Of course, our 6 neighborhoods in New Haven certainly reflect that. This work has been published last year in the American Journal of Public Health, and there's also about a 10-minute or an 8-minute video that the youth produced to describe that they had collectively that summer, in fact, walked 3,000 miles. So if you're interested, I urge you to take a look at that. In terms of the survey work, we quite literally knocked on doors and sat on stoops. And then again, just very, very quickly, a brief summary of these 1,205 surveys was that 1 in 5 residents reported food insecurity. That is, they skipped a meal in the last 30 days because they didn't have food or money for food. 1 in 4 reported high rates of stress and depression. 1 in 3 were daily smokers. 2 out of 3 felt unsafe in their neighborhoods. And in the work we did in the schools, 1 out of 2 children, these were 5th and 6th graders, were already overweight or obese. These were 12 randomly selected schools from among the schools in New Haven. We used this evidence to drive our action. And so again, in the food domain, we've been involved in the New Haven Food Action Plan that will be released later this year. CARE's the primary sponsor of that, out of the New Haven Food Policy Council, with goals of increasing access to healthy food for all, strengthening our local food economy, and encouraging healthy food choices through education and marketing. We've been involved with the health department in a Healthy Corner Store initiative. We have 4 healthy or healthier corner stores. Gretchen and I were talking last night how difficult it is to implement and sustain these models. But just to give you a sense, this is Adams, and this was Adams before the extreme makeover, chips and soda right at the front, and this was literally about 12 hours later. We painted the store, and you can see fruits and vegetables and healthier choices for snack foods. This photo was just taken yesterday at Start Bank, a community bank on Whaley Avenue. These are some of the leaders from our neighborhoods. Again, those of you who know New Haven or are from New Haven, Hill, West River, and Chatham Square Neighborhood Associations. These are our leaders. They are transforming their neighborhoods, and we are so pleased and privileged to be partners with them. Just a note on the schools. At the same time that we initiated the neighborhood work, we began work in the public schools. We're working in a dozen randomly selected schools. We're doing surveys, physical measures, and blood pressure, which we did in 2009. We had an 88% participation rate, which is pretty extraordinary, and now we are engaged in a brand new RCT. Marlene and I are multiple PIs in this, and so we're continuing the work with the public schools. Some of you who know New Haven and Dean Cleary, welcome. People will say, how is it that we get to work in the schools? The Yale town gown community stress. And my response is because we're focused not just on health, which is our priority, but on achievement, which is the school's priority. And as I said, as a mother of 2 middle school age kids myself, I want the schools to worry about their achievement. But if we can show the link with health and achievement, then I think we create not just access, but a true collaboration. And what you can see here is that when we, regardless of the health promoting factors, though most of them are around reducing obesogenic behaviors, or the fat approach, as you said. And as the number of health-promoting factors increases, regardless of which one, we see academic achievement increase. Academic achievement here is measured as the percent of students who achieve goal on Connecticut Mastery Test for reading, writing, and math. And we see a 2.2-fold increase from the lowest tertile to the highest tertile for those kids engaging in the highest health-enhancing behaviors. So not only are they healthier, but they are better able to learn. I'll close by mentioning Book Food. I know a number of you will be joining me this afternoon across the street at the Peabody Museum, and I'll have a moment later after lunch to talk a little bit more about that. But in the relation to dissemination of research, It's just been an incredible opportunity to curate this exhibition and, importantly, to think about the number of people we will reach with these public health messages. Even in our small city of New Haven, we're expecting nearly 200,000 people to be through the exhibition. And I'm remiss to say that I think in my entire career, and maybe all of us combined, our academic articles may never reach quite that many people. We've already broken records at the Peabody. More than 50,000 people have been through since the exhibition opened in February, and we're looking forward to welcoming you all, or many of you who can make it this afternoon. So I'll close where I started, around evidence to action. This is not a new idea. In the 6th century, Abu Bakr said, "Without knowledge, action is useless, and knowledge without action is futile." And I think that's the best introduction to the panel that we have assembled today.